Everyone, this is Dr. Lorelei Walker, and this is part of a series about public health and systems. So what does COVID, bridges, and cavities have to do with each other? Well, here recently in January 2022, we've seen a lot of trash hanging out. Trash is really hard to move right now. And actually, it turns out there's been a lot more trash since the start of the pandemic. Why? Because darn it, it's really helpful to have food delivered to your house or groceries, not have to go out. And the whole system has started in order to make this cheaper and easier and more accessible. Our families found it very helpful. But what does that mean? Well, people are eating more at home. So you have more individual trash. We also have a lot more medical waste. Tragically, more medical waste. And so the entire system of garbage removal is hauling more trash. So here in King County, unincorporated King County is where all of those roads are in between cities. It's not very well funded. Cities kind of get their own money. A lot of people use the roads in between. But to the point, the weight trucks could hold for the roads had to be increased so they could get all this trash going out to the dump. And what does that do? Well, that puts more weight on the roads and the bridges. We have something like 88 bridges that are not up to snuff right now. And they take a long time to build a new bridge. So what does that mean? Well, there's more deterioration going on the roads. And so the roads are going to start to crumble faster. So as we kind of just get our feet on the ground with business, economics, schools, getting home, paychecks, unemployment, we're going to start to see a fallout of our deterioration of roads. And then where's that money going to come from? Why? Because we're on the back end of all of this. We didn't fund it on the front end. Prevention. Prevention on the front end is much cheaper. And then when you're in a time of crisis, your roads work, which is kind of good. Now, prevention and cavities. COVID, masks, we're all open mouth breathing. Open mouth breathing is a lot easier in a mask, but what does it do? It dries your mouth out. What do dry mouths do? They increase the rate of cavities. So sugar-free gum's a good one. Trying to breathe through your nose is a good one. But basically, we could probably expect to see the rate of cavities go up, especially amongst children in the next handful of years. Why? Because the teeth are deteriorating faster, because they're in an environment that's drier, and we're not doing prevention on the front end to teach people about this. We're not doing prevention on the front end in order to keep our bridges working and our roads working so that when we need to rail the heck out of them with a ton of waste that we haven't figured out what to do with, hopefully we'll figure that out very soon, they'll work. There's an example of systems and how COVID is stretching them. Use this to expand your imagination, and then we can see things as they come down the road a little bit ahead of time, and we'll all be a little bit more open to what prevention is. And prevention is public health.